Hello, my dear friends. Welcome to Live Prep. Myself, Dr. Gajapati Verma. In the previous lecture, I have informed you regarding what are the various equipment that are used, how exactly we are using those things, some basic information we have discussed. Now, this is also another important lecture, and here I am discussing about some skills. Please remember, under the basic scuba diving course itself, they are teaching some skills. Okay. First, I will tell you what are these skills, and after that, I will tell you why we need to learn these skills, and then I will show you some videos. I cannot show all these particular skills, but for majority of them I tried my best to record some videos. So those things I will try to show you here. Now let's quickly go through this. So here, what exactly is this? So scuba. Scuba itself is an acronym. It is an abbreviation. What is the full form of this scuba? Self-contained underwater breathing apparatus. Okay, so this is actually the full form of scuba. So that's why the term scuba itself is an acronym abbreviation. Clear? So this is what. And now some skills I am saying here. So what are these skills? One is BWRAF. What is this BWRAF? Before you are going for the dive, okay, you and your buddy, please remember here buddy pair system is very important. You are not doing alone. So compulsorily 2 members together they are doing this particular scuba diving for the safety purpose. So that's why suppose I and you are doing, so you are my buddy, and for you I am the buddy. So please remember both the buddies, they should do all these activities together. So that's why it is coordination is very important. Okay, and one has to cooperate with each other. So now what the thing is, before you are going to the dive, so you are entering into the water first. Okay, and there you are actually doing this first checkings. Without this you cannot go for the dive. So this is the most important one. So in that, what is the first one? BCD. For the BCD, what you need to check, whether all the straps are properly kept or not. Okay, and then whether BCD, inflation, deflation, or are they working properly or not. So all these deflating positions you need to check. So whether LPA, through the LPA, is it working properly or not. So all these things related to BCD you need to check. And next one, weight. So are you wearing the weight or not? Properly, is it adjusted or not? Is the distribution proper or not? So all these things related to weight also you need to check. Next one, release straps. All the straps related to this and all the things you need to check properly. Next one, air in the cylinder. So in the cylinder, whether it is full cylinder or not, whether it is properly open or not. Sometimes you are keeping the full cylinder, but it may be closed. So in that case, the problem may happen. So that's why you need to check all these things related to the cylinder also. And not only this, regulator also. For the regulator also, primary octopus, secondary octopus, that means secondary stage. Both of them also you need to check properly, whether they are working fine or not. Are you getting air or not? So that also you need to check properly. Next one, fine local. Not only this, many other things like fins and all, are they properly fixed or not? So in this way, all the things you need to check, and then only you need to go for the descending. Okay, and when you are going for the descent, okay, when you are descending, then also you need to follow some things. So for this, you can easily remember the sorted. What is the sorted? First you need to go for the signal. So boat captain has to give the signal, and you also need to give signal to the boat captain for that you are going down. Yes or no? And next one is regarding the orientation. What is your location and where exactly you are there? So based on the natural markers and also, so this side hill is there, and here there is one tree, here there is one rock is there, and here this one is there. Likewise, some orientation and where is your boat. All these things also you need to check properly. That is about the orientation. And next one is regarding the time. At what time actually you are going for the dive. Anyhow, in the dive computer, so it will show all these things. That also you need to observe. And next one is elevate. So if you want to go down, what you need to do? So you need to elevate your that inflating hose, right? So you need to elevate that, and then you need to release the air. So by pressing this, the air will be released. So you are pressing this so that you are going slowly down. Okay, don't go to direct like this. Don't go to pull all these things at once. Slowly, it should go slowly, because in the theory information of the paddy content, I will discuss about this. Why you should go slowly? Because in the water, once you are slowly going down, what happens? Pressure on your body parts will be increased. So wherever the gaps are there, their pressure will be created. No, pressure will be increased. So slowly you need to equalize that. Without equalizing, if you are going to the depth, what happens? You will start getting pain. Okay, you cannot bear it. So again, you need to come up. So that's why all these things in the theory content I will try to cover. So better those who are interested for this scuba diving, please go through those. theory lectures also separately. Okay, anyhow, that link also I will try to give in the description of these particular videos. So that's why you need to go little bit slowly. That's what about the elevate. And next one, equalize. Once you are going down slowly, as the depth is increasing, what happens? From the top you are counting the depth, right? From the top, as the depth is increasing, so pressure will be increased. So you need to equalize the ears and all, or else you will get huge pain. You cannot bear it. Okay, that's why. And then slowly descend. These are some things that you need to understand. Next one. So then you are going and then you are doing the dive and you want to come up. When you are coming up, you need to follow the stella. What is the stella? It is for the ascent. So it is again the signal your body. You need to signal your body that you are coming up. So that signal also you need to give. And what is the time? So initially when you are going down, at that time you saw the time. And now when you are trying to come up, then you need to check the time. Okay, anyhow you need to check the pressure also. Okay, and then check the time and then elevate. Now this time also you are elevating. Don't think that when you are going down you are deflating it and now why you want to again deflate it. So concept is very much important. So you need to deflate here also. Okay, because once the depth is increasing, air is getting compressed, right? Air is getting compressed. Already you are under the water. Okay, when you want to come up, what happens? Now air will start expanding. When it is start expanding, you will be coming at higher speed, and that is not good. In the theory information I will give the full details. So that's why here also you are elevating and then here also you are deflating, and with the help of the fins you are swimming up, vertically up you are swimming and slowly you are coming up. Please remember this. And then this is what you need to do. And not only this, you need to listen to the sound. Okay, surrounding sound. If some ship is coming somewhere, for that also you need to see. And then look upside also. Suppose already exactly above you, if some boat is there, so you may go and hit it. So that's why keep it up like this. Face the keep the head up, and then you just start looking at the top, so that nothing should be there. And other hand also, this hand you are for using for deflation, and this hand you just keep above your head. Suppose all of a sudden, suppose you are coming to the surface and you are hitting, your hand will touch first. Okay, not the head directly, like this. And then ascend. Slowly you just come to the surface. This is what. And now what are the different skills? And why I am giving this particular list? Because I could not able to make videos for all these particular skills. So at least for each and every skill, you just check on the YouTube and then you just get more clarity. Anyhow, I am trying to show some videos. I hope you can understand based on those things. But still, if you are having doubt, I don't say that I made a best videos. I made the best videos. So, but still, if you want to get more clarity, you can go through YouTube videos. So many videos are available. But at least before going to the scuba diving course, if you want to search on the internet, at least you should know some names. For that purpose, I am giving this. So go through these particular skills. Okay, try to observe these things, how exactly they are doing. So then when they are saying, when the instructor is telling you during the course, then you can easily understand that. If you don't understand what exactly they are saying, after going underwater, if you make some mistake, you may face problem. So that's why learning skills is very important, right? Okay. So that's why these are the skills. Okay. The question is, why you need to learn these skills? This is very important. Now, if you see, so here I wanted to tell you the point very clearly. Suppose I am a tourist, I am going to some dive shop. I am going to dive shop and I want to do just one recreational dive. I want to do just one recreational dive. If I am going for a recreational dive, do you think that that instructor will teach all these skills to me? No, they will not teach. Because anyhow the instructor is there, they will take care of us and they will not take the tourist to the maximum depth. They will take you to just some 5 to 6 meters depth in general. And if you are okay, then they may take you to a little bit more depth. Okay. So in those cases, you don't need to worry about the skills because already your instructor is taking care of you, everything. Okay. Or the dive master, whoever is coming with you, they are taking care of you. So you don't need to worry. So you just simply focus on enjoying the nature. That's it. But here it is not like this. Here, the main purpose of this training is one day you should become independent on your own, so that you should be able to go for the dive on your own. So when you are going for the dive on your own, you may face some problems. Suppose this regulator, suppose it has, suppose by me, you need to keep it like this. Suppose by mistake you have opened your mouth. Now it is falling down. Then how you will take the air? You should know that skill, how to recover that particular regulator. Understood or not? And again, you need to keep it back. And by the time you are taking it, this one, it may take some, suppose it is taking some 10 to 15 seconds. Okay, immediately you recognize that it has removed. And now you need to recover it and keep it. And until then, for that 10 to 15 seconds, you should hold your breath, not just completely holding, slowly you are releasing the air, because completely holding at that depth also problematic. So that's why you should never hold your breath in scuba diving. Okay, so that's why what you need to do, slowly you need to release, and then meanwhile you need to recover it. All these things you need to do underwater only, and again keep it back. So then it will be normal. So in this way you need some skills. Okay, so in this way different things, for every skill I will tell you what is the significance of this. But before to that, what has happened to me, that also I will tell you. I learned all these skills very well, everything is fine. On the last day means for the combined course, it is the day 15, right? On the day 15, what has happened is actually that primary means primary second stage. I am saying that it is the regular that I kept in the mouth and I went underwater. But for that, there is a mouthpiece, right? That we are actually we are biting that particular mouthpiece with our both the jaws, right? We are keeping with the teeth, we are holding it tightly. And actually, that is actually fixed to a particular that is called, there is a particular opening is there. There actually it is fixed. Actually, if it is damaged, you can remove and you can keep a new one. So that's why it is called as mouthpiece, right? So that is a replaceable mouthpiece. Nice. Anyhow, for everything that will be like that only. But actually, no one will teach you that particular skill if it is removed. So now for me, what has happened here? So I kept it like normal and I went underwater and I am diving with all others. So it's okay. Everything is going fine. But all of a sudden, what I have recognized is this mouthpiece is in my mouth only. But I am taking air, right? Like this. I have observed that water is coming in and I have again spit it out. And again, I did like this. Again, water is coming. I didn't understand why water is coming. So then immediately, please remember this is water, underwater only. And suppose you are deliberately removing it, generally what you will do, you will take air and then you will hold and slowly you are releasing. And meanwhile, you will recovering. Okay. But at this time, what happens? All of a sudden, it has happened. That means technically what happened, just the mouthpiece is in my mouth and remaining that second stage is really removed. I lost that one. So then I came to know that I did not have that particular second stage. So I am not getting the air. Then what I did, already I learned this skill. So immediately, so using the shift method, so I have got that particular one and I got it. Okay, I got it. But the thing is, then I saw that now mouthpiece is in my mouth and that is not having this mouthpiece. So the thing is, now underwater by holding the breath, I cannot do all these things. So immediately what I did, so it had a problem. So what I did, I have thrown that and I have the alternate second stage. Immediately I took the alternate second stage. And this mouthpiece I held with one hand and I kept this alternate mouthpiece, alternate source, and now it is normal. And I hold it and then I came to the top, and after coming to the top, again I have fixed it. Now you just understand it. Do you actually do this particular skill during this skill? No, you are not doing this one. But you are doing another one. What is that? Regulator removal and then replacement, regulator recovery. This type of skills you are doing now. These things. And when this is not working, you need to use your secondary alternate second stage. So these are the skills actually we learned. So these skills I have applied at that time. So in this way, why you need to learn these skills? If no problem happens, there is no problem for you. Everything is fine. You don't need these skills. But the thing is, since we are using some equipment may fail. Generally, they won't fail. Equipment may fail. If equipment fails, or if you have some problem, you got some problem. Suppose you have completely used the air underwater and now there is no air. How you will come to the surface? And these are some problems that may happen. Maybe 1 in 1 lakh, maybe 1 in 1 lakh. But that one is if it is you, then how you will manage the conditions. So to face these such problems, so what are the general problems that may happen? These are the general problems that may happen. So in those conditions, what you need to do? These are the skills. In simple, these are the skills that you are learning. Suppose in future, if some problem happens, how you need to react? These are the skills that you are learning. Simply first I will give the names and then we will go. BWRF already I have explained. Sorted already I have explained. Stella already I have explained. Now breathing. What is the normal breathing? Underwater, normal breathing. When you are keeping this particular second stage, then how you are doing? After removing, how you are doing the breath? Okay, remove and replace. Okay, anyhow, that regulator removal and replacement is there. That is also there. And not only this, sometimes what happens due to some equipment failure, continuous flow is coming. Generally, normally what happens if you are taking inside, then only air will come, or else it will not come. But sometimes due to malfunction, some free flow may happen. Free flow may happen. If free flow is there, if it is continuously coming, then you cannot do normal breathing. Then you need to take this out and keep it halfway, and then off only, that air only you need to take it. So for this actually I think I did not make the video. Better you just practice that particular one from the YouTube video, observe the YouTube videos and then you just get it if it is free flow. And these are some things that you need to learn. Next one, regulator clearance. Okay, so that regulator, whatever the primary secondary stage we are using, so how you need to clear that particular one. So there are some methods. Purge method is there, blow method is there, those things we are using. Regulator recovery, suppose regulator is removed by mistake, it is removed from your mouth. How to recover this? One is by swift method, you are sweeping and collecting it. Other one is by the ridge method you are getting it. In the videos I will show you. Okay, next one, half mask clearing. So suppose to the mask half of the water is filled up to this one, then how you will clear it? Suppose it is fully covered, fully flooded with the water, then how you will clear this one? Next one, mask removal and replacement. So mask is remove and replace. Why you need to practice this? Sometimes slowly, suppose some water is coming here, suppose it is loose, what happens? Underwater, mask is removed. Suppose mask is removed underwater, you should not be panic. That's why you are practicing this. You yourself, you are removing and then you will replace it. So in this way it is a skill. Suppose in future during practice, if it is removed, no problem, you know how to replace it. That's what the skill is. And next one, no mask breathing. Suppose mask is anyhow in the mask, this will be closed. So you are not using the nose. Suppose mask is removed underwater, then you may tend to use your nose. So you should not use that. Still you need to breathe because anyhow this air you are getting through the mouth. So that is also a skill that you need to practice. Okay, that's what no mask breathing. No mask swimming. If mask is not there, your visibility will be reduced. You cannot see properly. But still, suppose sometimes when you are doing this diving, suppose you lost the mask. You lost the mask completely. Suppose it has fallen down. You cannot able to recover that. Then you need to come to the surface. Yes or no? So without the mask, you need to come to the surface. That is the practice. So no mask swimming is also a skill. Next one, sharing air. Suppose my air in my cylinder air is completely depleted. Now I need to ask my buddy to share his or her air from the cylinder. Anyhow, they are having extra, right? Secondary is there. So that I need to take it. How you will ask it? So that is also a skill. Okay, next one, CISA, controlled emergency swimming ascent. Suppose air is completely depleted and there is nobody nearby and you need to come to the surface. How you will come to the surface? That is a CISA. Okay, next one is BCD removal and replacement. Suppose there is an issue with the BCD when you are underwater, then how you will remove and again you will replace it. That's what the skill is. And how much weight should be added? So initially, so I said no, after wearing the wetsuit and after wearing BCD and cylinder, you are not sinking, you are still floating only. So you need to, if you want to go dive underwater, you need to wear the weight. How much weight you need to wear and how to adjust it, that is also a skill. And the LPA, disconnect and reconnect underwater. Why you need to disconnect underwater? Here there is one issue is, sometimes what happens is auto inflation may happen due to some problem. After connecting LPA, actually what happens? After pressing a particular button, then only air should enter into BCD. But sometimes what happens? Automatically air may enter and auto inflation may happen. If auto inflation happens, what happens? air is entering into BCD, you will be floating. All of a sudden you are coming to the stop. Then what you need to do? Immediately you need to disconnect. So disconnect underwater. So it is not that much easy. Disconnecting and connecting on the surface is very much easier, but disconnecting underwater is a little bit problematic because it will become a little bit tight. So that skill also you need to know. That is one thing. So to when it is auto inflating, to prevent the auto inflation, you are disconnecting the LPA. That is one thing. Second thing is when you are using DSMB, you need to send the air. At the time also you need to disconnect LPA and then you need to connect to the DSMB and then fill the air. And then when you are using the lift bag, there also there is a port for this particular one. Then also you can use. So in this way, if you are using such type of equipment, then you need LPA. So disconnect from this BCD inflator hose and then connect to those. And after using that, again reconnect to this particular one. In this way, that also you need to know. And these things you need to do underwater. And then cramp removal. Generally, there is a problem of the muscle cramp for the leg because you are keeping the leg like this and you are doing like this. And these calf muscles generally, okay, not for the hand, you just imagine for the leg, for the calf muscles and there and for the thigh muscles, okay, quadriceps and all, generally you will be having some cramps. So how you will remove this? That is also a technique. Next one, cylinder loose band. Suppose there is a band that is actually tightly fixing to this cylinder. Suppose it got loosened. Now there is a chance that your cylinder may move away from the BCD. So if that happens, how you will exactly fix it? So these are some things. For all these things, I did not make the videos directly, I'm telling you. So some of the things I made, so you please watch those. For remaining things, you please search on the internet. At least if you know what to search on the internet in the YouTube, so at least you will get some information. Okay, use this information. So fin pivot. So in the fin pivot, so we are actually wearing the fins. So generally we are touching with the fin tip, you are touching the bottom. And now what you need to do, you need to maintain your buoyancy. By breathe in, you need to lift up. When you are breathe out, you need to go like this. And this is all related to buoyancy. And hovering is also. Suppose you are in a sitting position in the underwater. In water, in the submerged position, you are sitting like this. Okay, you are not coming to the top, you are not going to the bottom. So you are able to maintain that. That is the hovering. These are all the techniques that are related to buoyancy, and you can get these particular things by practice only. Okay, not in a single day. Next one is regarding air depletion. Suppose, so for air depletion, suppose air is completely used. So you don't need to completely use it. Someone will be standing behind you and they will off the regulator. Once they are offing the regulator, what happens? After some time, you cannot breathe. So that breathlessness, you need to feel it. Okay. Once you say that you are not able to breathe it, then immediately anyhow they are there, no? So they will loosen that. Once you will get the air, but you need to feel that. Suppose when you are doing this particular scuba diving and all of a sudden that air is not, you are not getting the air, then how you will feel that and how you will know that and then how you will act it. So all these things in advance you are trying in the form of skills. Okay, skill practice. This is what. Next one, weight belt removal and replacement. Sometimes, so after going underwater, that weight may be disbalanced. So you want to adjust it. So then you need to remove it and then replace it. That is also a skill. And emergency weight drop. Suppose under that seizure condition, suppose you want to come to the surface and you want to release this particular weight. And then that is also a technique that is also you are practicing. And wearing the BCD on the surface of water. This is also very, very important skill. So when you are on the surface, so it is very easy. But sometimes what happens is, so they will take you to the, on the boat, they will take you to some distance. Okay. And it is completely water only. So now what you need to do, first they will, first you are jumping into the water. And then they will give you your BCD with cylinder and everything. And on the surface of water, you need to, like this, you need to wear it. Okay. And that is also a skill. Okay, so that skill also you need to practice. Next one, backflip from the boat. So you are wearing that BCD cylinder and everything in the boat only, and by sitting at the edge of the boat, you are making a backflip. That is also a technique. Okay. Next one, jump from the boat. So actually you are not jumping from the boat because anyhow it is close only. So instead of practicing from jumping from the boat, better jump from the cliff jumping. So already in the previously also I have shown one video, right? So two instructors and one of my batchmate, they have jumped, right? Likewise, you also please practice. At least if you are feeling fear of that drowning and all, wear the wetsuit and then jump. That's it. You will not sink down. No problem. You, even though you don't know swimming, still you will float. So no problem. But the jumping, you need to do it. Okay. Better you just jump it. So we also tried different jumps from that dive center itself. Okay. And we swam to other side of the river, and there we climbed almost 50 to 60 feet height. Okay. And from there also we have jumped. Okay. Those who feel that you can jump, so you can try it, no problem, but try jumping. Okay, sometimes this is also a method to enter into the water. Okay, once you are jumping, you are entering into the water, and once you are entering into the water, then you know how to wear this BCD and all. So these are different techniques. Okay, and next one is fins kicking. What should be the leg movement? So many times what happens, many members are bending the leg like this and they are doing like this. It should not be like this. You should not bend your knees. Suppose this is the leg and this is the knee joint. You should not bend your knee joint. Simply move like this. Okay, and this leg also should be stretched backside like this, so that your fin will come like this. Like this, you just move slowly, you just move. It will give a more push. Okay, if you are doing like this, so you cannot move forward. So this is what the thing. So these are some skills I am mentioning here. So these are the various skills that actually you need to practice. Clear? And regarding these skills, so now I will show you some videos very quickly. Let us quickly see these videos. First, we will see about the kit up. So this is the BCD. So this is the back side of BCD, and this we are attaching to the gas cylinder. This is the new one. That's why dust cap is there. We are removing that particular dust cap, and now we need to check the O-ring. Okay, and now this side it should face. Okay, and this is the strap or the band, cylinder band, and here it should be 4 fingers width, and then we can lock it tightly. We need to keep it tight. Okay, so this one also we need to keep it here. Okay, these two should be in the same line. So now by holding this, we can lift this cylinder and all. Okay, this is the regulator. Already I told, no? On the right side, what should be there? Second stage. Second stage, primary second stage and alternate second stage. Both of them should be on the right side. On the left side, LPA and SPG will be there, right? So in the same way, we need to fix it. Okay. And now we need to remove the dust cap also. So this is how we need to fix it. Okay. So first we need to remove the dust cap. So we need to loosen that. So then we need to remove the dust cap. And now that first stage we need to fix it to cylinder. First stage should be fixed to cylinder. Okay. So LP and SPG on the left side and the second stage on the right side. So we need to fix that. And then we need to tighten it. Once you are completely tightening, so make it small, little bit loose, just one thread. That much is enough. Okay. So once we are releasing this one, it will become tight. So once we are releasing that air, that will become very tight. Okay. And now that is the LPA. You can directly, after keeping also, you can do like this. And now this LPA we need to attach to this. Already I told, now we need to pull it down and then fix. Okay. While keeping this, you keep the hand like this for support. Okay. Once again I'm removing fixing. So that's how you are removing. That's how you are fixing. That's it. Okay. And now you just attach there. So now that part is ready. And this is the SPG. Okay. And now before we are releasing this, now if you see the pressure is 0. Before we are releasing this, now hold like this and we need to press it. If you are pressing this, some air will come out. So before we are releasing that, you need to press it so that some small air will come. Okay, let it come. Or else there is a chance that at high pressure if it is coming, so that may break some of this. So if you are releasing some small air, no, so no problem. So let it go and you just completely release it, completely loosen this and then just one thread tight. That much you need to do, just one thread tight. That much is enough. Okay, over. Now let us see the pressure here. Now let us see the pressure here. So it is almost 190. It is okay. Okay, almost 190 bar. The pressure here units we are using are bar. Okay, so generally this one we are keeping in this side pouch and that secondary we are keeping in there generally. But now we need to test it, right? So whether we are able to get the air or not and whether inflation is proper or not. So those things also we are checking here itself. Clear? So with that part is over. So that's how we are fixing BCD to the cylinder and also we are connecting the regulator. And then you need to check it whether that through the LPA, so whether air is coming or not. And then deflation checking, all the 3 ports we are checking. And then regulators, by keeping in mouth we are actually checking whether we are getting air or not. So during that time SPG should not be in the SPG, whatever that pressure indicator is there now. So that should not be moving. If you are taking the air, that should not move. Suppose somewhere it is off and while you are taking the air, now it will be like moving. Okay. Anyhow, those things they will tell you separately. Next one. So wearing the wetsuit and the shoes. Now let us see this. Now this is the wetsuit, this is the front side and the zip side is the back side, right? Now better wear the swimsuit. Better this should be full. If you are getting the full, better you just get the full one. Okay. Swimsuit. This is the swimsuit. So over that we are wearing this wetsuit. Okay. And then according to your size, you can take that wetsuit. Okay. And here there is a Velcro, so you can simply fix it. Okay. So this is how you are wearing this wetsuit. Clear? After that, now we need to wear the shoes also. Okay. Somewhere here. Yes. Yes. Okay. And now you need to wear the shoes. Check the size and then wear them. Anyhow, this is like normal only. And anyhow, side zip will be there. You just fix it. Okay. And now you just observe it. And after wearing these shoes, now for this bottom now, so you need to cover it like this. Okay. Still water will go, but this is the general practice. So do like this. Okay. That's it. So this is how we are wearing this wetsuit and all. And now you know how to wear this particular BCT and all. And after wearing that, now you can go to that water. Okay. Next one, floating. So this is a little bit important. And here I wanted to tell you one thing. So those who are feeling fear of drowning and all. So please remember, once you wear the wetsuit, you will float automatically. You will float automatically. Okay. See here. You will float automatically. You don't need to do anything. Okay. So you don't need to have any separate skills. Generally in the swimming also, they will tell you to back float. So even though you are drowning during that time, still no problem. Still after wearing this wetsuit, you will float. So you don't need to worry about swimming and all. Okay. But anyhow, for the swimming test, you need to know the swimming. And now this is about the mask clearance. Okay. For the mask clearance, what we need to do? So first, Actually, all these things we need to do underwater. The problem is, so initially for initially I think approximately for 10 days, water is very clear, and you know that this river is the Asia's cleanest river, right? So it is clear. So I thought that in the last 1 or 2 days, so it will be better if I make some of these videos. But the problem is after 10 days, now it has started raining for continuously 3 days. So because of this, we lost the visibility. So actually, I plan to do all these things underwater, but so since visibility is very less, so even this much is also visibility we are not getting. So even 1 meter visibility is also not there. So that's why I thought that it will be better if I do on the surface. Okay, so that's why here I am doing. So you just try to observe these things. If you still have any doubt, so there are some YouTube videos that are available, so you can go through those videos also. Okay. So here in this mass clearance, no, the first and foremost thing is, please remember, still even after completion of the course also, I observed that many members are making mistake with respect to this clearance. The thing is, see here, when you are diving, somehow the water is entering inside. That is what the original thing that is happening. Now you want to clear this particular mask. And how you are clearing this? What the mistake many people doing is, they are holding like this and they are lifting like this. Don't do this one, don't do this one. There is a clear blunder mistake. Okay. The thing is, you just use these fingers and press here. On the mask, you just press here. Okay. So anyhow, water has gone inside and you need to take a breathe deep. Okay. So breathe in deeply. And then first you just bend your head downward. Press here. Only press here. Only press here. And starting from here, you just start blowing out through the nose. Through the nose, start blowing like this. This is what you need to do. Press here. Don't hold here. Some members are doing like this and like this. Don't do that. Don't do that. Simply press here. Okay. Start from here. Do like this. That's it. Water will go out. Suppose with one blowing, if water is not going out, do once again. That's it. Okay. So that's what actually you need to do here. Okay. So not directly here. So from the bottom, you need to do this. Okay. That's what. It will be cleared. Okay. Very simple technique. So sometimes, so in the whenever you are going normally, so water may enter into this. So it may be half filled or completely filled. At that time, this is how you need to clear your mask. This is what the meaning is. Okay. That's why you are practicing this particular skill in advance. Okay. Next one, mask removal. So suppose you suppose mask has removed or you want to remove the mask, then how you are exactly removing this, and then how you are replacing this. If you want to remove the mask on your own, then what you need to do? I said no, you should not pull like this. First, you just press it like this so that you are creating a gap so that let the water enter inside. Once water goes inside, it will be easy for you to remove this. So that's what we are doing. By pressing here, I am sending the water and then you can remove like this. No problem. Okay. Like this. See here, this regulator should be inside the mouth because you just imagine it is underwater. Okay. We are doing this underwater. So with this only you are doing breathing. And at this time with the nose, you should not breathe. Okay. You should not breathe with the nose. Please understand this. So this side strap should be above the ear and make them very much proper so that generally there is no problem. Okay. And one more point here is whenever you are facing the mask, please remember, for generally for the gents that problem may not happen, but generally for the ladies what happens, because of the long hair, sometimes what happens, hair is coming here and mask is going above the hair. Please remember, if the mask is going above the hair, now what happens, there are some small gap will be there and now there is a chance that it may move here and there. So whenever after keeping the mask, make sure that this hair should not be there here. You just pull it back so that here wherever the mask is there at that particular location, hair should not be trapped. This is the point that you need to keep in mind. Okay. This is one thing that you need to understand. Next one. Next one. Snorkel uses. Already I told no. So here there is a clip and to this clip we need to fix the mask. And that too on which side we need to keep? If this is the mask, on left side only we are keeping the snorkel. So this fixing also you need to do for left side strap only. For the mask on the left side strap only you need to fix it. Okay. Now observe this carefully. This is the mask. So this side will be the left side. Okay. And here I need to fix this particular one. Right. So here, this is the mouthpiece you are keeping in the mouth. So now on which side? On that side you need to keep it. Okay. So now you are fixing this. Now here it is having a small opening. So through that opening you need to send that strap. Okay. So they are the tourists. Huh? So tourists are also going there. So please take care of them also. Okay. So you can change that one according to your convenience. These are our instructors, so don't worry. Okay. So first you need to fix the mask properly. Okay. So after this, now keep that mouthpiece in the mouth and then you can adjust that particular strap. Make sure that it should come above your head. That should come above your head so that, and now I will go to this flat swimming position. Observe carefully. Okay. So this is what the flat position in which you are there. And now you don't need to worry about the breathing because you can take the breathing with this mouthpiece only. Okay. And now for this, air is coming from the top. And now what is the basic technique here is make sure that this water level is up to ear level only. If you are going, suppose this is the water level. If you are going below this means what? So this top of the snorkel is also coming into the water. So then you will face the problem. So make sure that you are at the ear level. Okay. So then always this snorkel top will be at the in the air only. So you will never face the problem. Okay. Suppose by mistake if water is entering into this, for that also I will tell you here. Okay. Now observe carefully. So this is what. So in this way you can happily breathe through the mouth only. Mouth only. Here also you should not use the nose. Suppose water is going. So for that I am bending and I am filling some water. Suppose water is going. Then what you need to do? Then water will go out. So you can simply blow out. That's it. If water is entering into this, simply blow out. So water will go out. Again you can do the normal breathing. So this is what. Okay. So in this way on the surface we are using the snorkel. Okay. Suppose sometimes what happens is from the shore some distance you need to swim. Okay. So when you are on the surface only you are swimming, at that time you should not waste the air that is present in the cylinder. So you are not using your secondary stage. So then what you do, generally we are using the snorkel and until there we are going by swimming. That's it. So in this way you can save the air that is present in the cylinder. This is also one thing you need to understand. Next, LPA connect and disconnect. Why LPA connect and disconnect we should learn, and that to underwater. Anyhow, on the surface also you are connecting for the first time. Underwater also you need to do this because sometimes auto inflation may occur. So at the time you need to remove that. And sometimes to inflate the DSMB, to inflate the lift bag and all those things, you need to first disconnect from this and do that activity and again you need to reconnect. So that's why this activity is also very important. But here I did it on the surface. So please understand this. Okay. On the surface. On the surface I am doing. So simply pressing. Okay. Okay. Yes. Pull down and then press down. Okay. And then when you are keeping, pull down and then fix and then release and then slightly press up the upside. That's it. Okay. That's how you actually are doing LP connect and disconnect. Regulator removal. Okay. So initially I'm getting ready. So it is the mask. I'm wearing the mask here. Okay. So this is the second stage. No, that's what the regulator I am saying. Okay. Regulator means that's what I am saying. Okay. So position also important. So that's what normally you are taking. Normal breathe in, breathe out, breathe in, breathe out. You should not use the nose. Okay, this is what you are doing. Okay. So underwater, what you need to practice, hold like this. Position is also important. Hold like this, take breath, take it. And now you just tilt your head slightly to the right side because on this side, right? This side means regulator will be there. So that's why to the right side you need to tilt and slowly release the air in the form of bubbles. And this is all practice. This is all the practice. Please remember this. That means for some time, even though regulator is not in your mouth, still you should be able to control yourself. You should not be panic. This is what the practice is. And now here I am doing something, right? And once you are keeping back, you just imagine underwater. So once you are keeping opening for this particular keeping it back, you are opening the mouth. At that time some water is entering. Then what you need to do? Here two methods. First one is blow. First after keeping, don't breathe in. After keeping, first you need to do so that whatever the water entered into your mouth will go out. Okay, there are some openings. Okay, so single direction openings are there. These things separately I will discuss in the theory part, so don't worry. So first thing is the blowing, blow it so that water will go out, and then again you can do the normal breathing. What is the second thing? Second thing is at the center it is having a button, right? Press it 2 times. 1, 2. That is called as purge. P-U-R-G, purge. That is called a purge method. One is blowing, second one is purging. Okay, so these are the two things. So that's why whenever you have underwater, you have removed your mask, removed your regulator, means secondary stage. Okay, you have removed, and you are again keeping back, then blow, purge. You can do any one of these, you can do both of these also. Okay, so these are some techniques that you need to understand. These are the skills that you need to practice. Okay, say it once again, press it 2 times. Okay, sometimes what happens is here itself, sometimes what happens now here itself, next skill will come. Sometimes when you are pressing like this, it may be pressed and it may struck there. If it strucks there, what happens? Now it is another skill, free flow. Free flow, continuous flowing. At that time of continuous flow, what happens? Now if you're making like this, generally it will set, right? Suppose still it is not setting right, then what you need to do? You cannot keep the regulator completely in mouth. Since it is continuously coming at that time, breathe in, breathe out, you cannot do. At that time, what you need to do? Keep it half open. That means, suppose it is the like this, you are not completely keeping in mouth, you are keeping half in mouth, half outside. Only some part it is coming, right? Only that you are taking in and out. But please remember, if you are after doing like this also, if it is not becoming normal, you should not continue the dive. You should, by doing like this only, come to the surface first. You should never take the risk. Okay, so this is what, anyhow, those things also they will teach you, and you will also doing these particular skills in that training area. Okay, next one, regulator recovery. For the regulator recovery, two methods are there, shift method and ridge method. Regulator, suppose it is removed, okay, or you lost it from the mouth, then how you will get it back? This is what regulator means, secondary stage. Okay, okay, primary, secondary stage. This is what. So now deliberately I need to throw, and I know until then, until I get it back, slowly, I am releasing the air. Okay, and now you just sweep. It is called a swift method. You are sweeping so that you are getting it and hold it, and then again keep it back, and once again that blow out and then purge, that you can do. So this is one method of regulator recovery, recovering the regulator. Okay. Next one, there is another method also. What is that method? That is called as a ridge method. In this method, what happens? See here, you are going to this particular one, right? And slowly go back and then hold that pipe and then take it. You are getting your regulator. Okay, that's it. Understood or not? Understood or not? Yes, that's it. And now, in my case, what has happened? In my case, what has happened? I kept it like this. That mouthpiece is in my mouth, but that remaining set has gone away. So now it is simply open. So water is coming in, water is going out. So now what I did? So I have, by using the sweep method, so I got it back and I saw it. When I saw it, now this is not having mouthpiece. I came to know that mouthpiece got separated. So then what I did, again I have thrown it, and then now I took it separately. And anyhow, here in the BCD, here itself you are keeping your secondary. Okay, alternate second stage is there. Immediately you just take that alternate secondary octopus, and then immediately I kept it. Again normal. So I simply purged it and then it is normal. But since it will take a little bit time to fix this one, I came to the surface and then I have fixed it. And again using that primary second stage, again I went inside. That's it. So in this way, don't be panic. Don't be panic. So whatever the skills that you learned, so if something happens, these skills should be useful. Okay, this is what you need to learn here. That's it. So in this way, there are some techniques to recover this particular regulator. Next one, purging. Already I told, no, press at the center. So you are doing like this. And whenever you are keeping back, some water may be entering inside. So then what you need to do? 2 times press it. Okay, that's it. Then you can go for the breathing. Better thing is first blow the water and then do the purge and then you can continue normally. Okay. This is what. Next one. Next one. If continuous airflow occurs. Okay. If continuous airflow occurs, then what you need to do? You need to keep it off. Okay, that continuous airflow is called as a free flow. Already I told, no, free flow. If free flow is happening, what happens? Keep it on this side, half in mouth, half outside. No, that you just remember, keep it on the left side, because this will be easy for us. If you are keeping on this side, no, already this pipe is coming from this side, so this will be difficult. So this, in this way, you just keep it half inside the mouth, half outside the mouth. So anyhow, this side it is coming the air, right? So remaining air is going outside, that we cannot do. Okay, so that's why you need to come to the surface immediately. Okay, immediately means slowly you just come. Immediately is also having some effect. In the theory lecture, I will cover you that points. So that's why all of a sudden you cannot come up. Slowly, you need to come. Okay, significance in the theory lectures also they will teach you. But anyhow, I am making a separate content for PADI lectures, right? PADI certified content, whatever is there. So with respect to that, I am making some video lectures also. Go through that. Without knowing these basic things, don't go for diving. Okay, my suggestion is, please understand this in this way. On the left side, you just keep it. Okay, so some air is coming in the mouth, some air is going out, let it go, no problem. Okay, now you just breathe. Okay, but at the time you just try to come up. Next one, sharing air. What is this sharing air concept? Suppose air in my cylinder has completely exhausted, means completely used up. Now my on the SPJ, now this pressure is showing 0. Now what is my next option? So to go to surface, right? But suppose it is a little bit far and it will take more time, and suppose my buddy is nearby, then what I need to do? You need to, please remember, don't do like this. The simple tapping may not aware your buddy. So that's why you just hold your buddy properly and then you just shake them, so that they will immediately give attention to you. Then you just tell them that this is what the signal. So if you are not having the air, this is what the signal. So say like this and then ask for sharing. This is what the sharing. That means I don't have any air. Give me your air. This is what the meaning is. So then what they will do? So there is a procedure that also they will teach you. So here I will show you that. First I will let me explain. Suppose I am suppose I am giving to you. Then you are doing this symbol and then you are asking like this. Then what I will do is, so then first I am having my secondary, right? On the right side I am having my secondary. I am having my primary. Never give your primary second stage. Please remember, you should always give alternate second stage only. Your primary is in your mouth only. And now this you need to keep in their mouth, and you are keep bringing it almost close to the mouth. Okay, then that fellow will hold it and they will let them place properly, because when you are keeping, you may not be giving properly, right? Give it up to the mouth, then they will hold and they will keep it. Okay, and once they keep in their mouth, then what happens? My right hand and their right hand, we need to do like this. Right hand to right hand, we need to hold. Why we need to hold? Can you go freely like this? No, because that original pipe is in connected to my cylinder. If I am going far away, then what happens? It will come out of his mouth or her mouth. So it may create a problem. So that's why you should not move away. So that's why both of you should hold your hands like this. And once you are holding, I am the donor because I gave my alternate source to you. Then I will ask you, okay, this is the okay symbol. Are you okay? Then after this, if that fellow is okay, they will say okay. Okay, or else not okay, they will say like this. Okay, then we need to wait. Let them be okay. Once they are okay, now we should not continue our dive. We should come to the top. So slowly by vertical swimming. Okay, so move the fins and then slowly come to the surface. Is it clear? Once you are coming to the surface, so you can remove that and you can use your snorkel. That's it. So this is what. And now for this, we are doing this exercise. Okay. Actually, he is our chef. Okay. So I told him, so we will do this particular one for the recording purpose. So I called our chef, Mr. Sandeep. In the last lecture, I will tell you. Okay. So he is. Now, what the thing is, suppose he is having this entire setup, let us imagine, but his is not having the air. So he is keeping this one, but he is not getting the air. And he checked the SPG and there it is showing 0. Now, this is not useful. So now he is asking, what he is asking, see here. Okay, now out of air, share your air. So now what happens? Now already he has regulated, right? Now he has to remove that. So that now I will give this one. Okay, now he is removing his and now I am keeping it. Okay, now he will fix it properly. And after that, right hand to his right hand, both of us we are keeping like this. Okay, then I am asking okay, he is saying okay, then we are keep. This one means what? We are coming to the surface. This is what. So this is what about the sharing air. So this is also a skill. So when it is used, I hope you understood. Suppose your cylinder got emptied underwater, so at that time we are doing this. So that's why these are all like we are imagining the problems in advance. If something happens in future, then all of a sudden how we need to act. So this is what actually that the skills and their purposes. Buoyancy control. This buoyancy control is a very important skill. So here once you are going underwater, so initially what you are doing, you are keeping it up and then you are deflating. Slowly you are going, yes or no? Once you are going to a particular depth, suppose you want to maintain that. So now you need to check it. So now you just release this button. Okay, means you don't press it. Suppose still you are going down, you are going, means you are, even after releasing this, still you are going down. That means what? You are having negative buoyancy. That's why you are going down. So you should not go down. That means what you need to do? You need to fill some air into the BCD. How you need to fill the air into the BCD? Already I told you, no? Already LPI is connected. So there is a button here. By pressing this, air from the cylinder will enter into this particular BCD. So that some air will come. Once some air comes, you will not go further down. You will be staying there. Suppose you are sending more air, what happens? You will be floating back again. That is the positive. So you don't need positive, you don't need negative. Neutral, maintain that. Suppose extra, again release it. That is one thing. By using this LPI. Suppose you don't want to waste the air from cylinder. Then how you will do? Then what you need to do? Underwater also you can do manually. You are taking breathe from the regulator, breathe in, breathe out. So generally what we do is we will take one long deep breath, hold, remove this, and then already this is there, no? Press and blow, release, and then again get back your regulator. So in this way, instead of simply releasing this out, this air we are using to fill this particular one. In this way, you are saving some air for extra dive. Understood or not? So in this way also we are doing. So that's what I am saying here, how to fill this. And now what you need to do, you do like this, okay, and check for some time. Okay, fill the air and do like this. Be flat, try to be flat. And whether you are going down or up, observe it. Suppose still you are going down, that means you need to fill some more air. Do it once again. Okay, do once and you don't feel like, it is not like you are taking complete deep breath and you are feeling complete. Don't do that. Small amount, small. Send small amount and then again get back your regulator and check it. Check it. Suppose you are going up, you need to release the air. Suppose you are going down, you need to fill the air. So in this way, you need to do this. And once you are maintaining that neutral buoyancy, that's it. No problem. Happily you can swim. Okay. So this is what, this is a technique. So how to fill this air, all these things I am saying here. Pressing this, what happens? Air will be released. This is also another one to release the air. And here also you are having on the right side, bottom right, that also, okay. So that by pressing that you can release the air. But if you are using these things, no, air will be released at a time. So at a time you are, means at a speed you are going down. So that is not good. Please remember. Okay, because equalization problem may happen. Simply I am telling you the possibilities. That's it. Now what you need to do, so with this regulator you are taking the breathing, okay, breathe in, breathe out, and then now you are keeping and hold aside and holding, right, that air you are filling into this. So press it, fill in this, and then release, take it back, and again breathe normally for 3-4 times. Meanwhile you just check for the buoyancy. If you still want to blow the air, so blow the air. So this is what the thing that you need to do. So these are some things that are related to the buoyancy. So in this way you just be flat and then check the buoyancy, but not on the surface. It is underwater, but the visibility is not good. That's why I did it on the surface so that you can see it. Next one is regarding the backflip. Backflip, actually see here, actually after wearing all this BCD cylinder and all the things, then backflip you need to do. But here without that I am doing this. So observe this carefully. So here you are wearing this particular BCD cylinder and all the things are on the back side, and here you are having the fins and all, right. Already weight system is also there. So in this, and when you are flipping, what happens is you are already keeping this regulator in the mouth. You need to keep the regulator in the mouth. Mask is there, everything are there. So when you are back flipping, what you need to do, keep one hand on the regulator so that it should not come out during the backflip, and keep one hand on the mask so that it should not come out. That means you are securing this, and now you are sitting at this edge. Simply backflip. Observe this video carefully. Okay, like that backflip, and again you will become normal. Until you become normal, you need to hold like this, and nothing will happen, no problem. Okay, you can take the breathing through the regulator, through the mouth. That's it. Anyhow, nose you are not using. Normal. So that's it. Once you are becoming like that, means what? It is a type of entry into the water from the boat. From the boat, backflip is a method to enter into the water. But here in the backflip, already you are wearing all these things. Clear? Next one. Sometimes BCD and all the things will be thrown into the water. Anyhow, they will float. Don't worry. And now you are jumping, you will also float. But please remember, when you are jumping, already you are having the weight belt on you. So please remember, if weight belt is not there, then you will be floating. But already you are wearing the weight belt. So with the weight belt, you are jumping. So please remember, at that time, what happens? There is a chance that you may sink. So that's why immediately you hold that BCD and all. Once you are holding that, you will not sink. So no problem. Okay. So you just wear it. Once you are wearing all these things, then you need to, suppose you are jumping. In this method, no problem. Backflip. Already you are wearing fins and everything. Suppose first you are individually you are doing. So first BCD and cylinder are thrown into the water. You are jumping into the water, and then you are getting the fins. Then what happens? Then you need to know how to wear these fins. For wearing the fins on the surface of water, in a separate video I am showing. So this is just about the backflip. That's it. With this, the backflip is done. And once you are entering into the water, whatever is the method, to say that you are safe, and you need to give the symbol OK to the boat captain. Okay, so if it is very close by, you can say like OK like this, or else you can say like this is like a circle. Whoa, OK, like this. Okay, suppose boat captain is far away, then what you need to do? You need to do a big O like this. Okay, in this we are doing. Anyhow, symbols I am not talking in these particular lectures. So anyhow, these symbols and all the things separately you can get in the YouTube video, so you can search for those. Okay, this is what about the backflip. Okay, next one regarding the floating. So see here, no weight system, there is no cylinder and nothing. So simply I wore the wetsuit. After wearing the wetsuit, you just see, simply you will float. You don't need to worry about the swimming. Okay, see it, whether like this or the reverse, whatever it is, you can float easily. You don't need to move any hands or something. Okay, now I will do the reverse also. Don't worry, reverse also. Okay, you can float. So once you are wearing this wetsuit, means you don't need to worry about the swimming or drowning and all the things. Okay, if you want to drown, you need to have that weight belt, then only you will drown, or else you will float. So don't worry. Okay, next one, fins. How exactly we are using the fins? Already I told you, right, in the equipment. Now we are after wearing the shoes, over the shoes we are actually connecting this. So this is for the adjustable strap. These are the clips for locking and all. Okay, so like this. Okay, if you press this, you can open this. And now that one also for adjustment. Press here, and then you can pull it for loosening. On the other side for tightening. That's it. In this way you are wearing these fins. Okay, both of these. Other side also. Other side also you are wearing, right? And now what I am doing, I am removing this, and I will go somewhere here. On the surface, by floating, you want to wear the fins. How you will do that? Do this. So now I am removing these fins. Okay, and I'm going deep there. Okay, and now I am floating. My legs are also on the surface. Now this is how you need to wear the fins. This is also a technique. Okay, so when you are wearing that BCD on the surface of water, and now you should be able to wear this fins also. So that's why you need to learn these things also. Okay, so don't worry about the drowning. Don't focus on drowning. You will not drown. So first try to do all these things properly. Okay, and now you are wearing the mask, and now I will tell you how to use the snorkel also. Fins are there like this, right? Now you don't need to use the hands you just keep like this, make it streamline, simply like this. See this particular leg movement. I will keep it a little bit backward. See the leg movement. Don't bend your knees, make them straight. And here also leg should be like, stretch it backside. So I am in this direction, right? So your leg, generally your feet will be like this. Keep it as far away as possible. Okay, and by doing this, what happens, sometimes you may get some muscle cramp in this what do we call, in this calf muscle, and sometimes in this quadricep muscles also you may get the cramps. There is a chance of getting cramps. So that's why during the PT, you need to take the PT seriously. Those who are doing the PT properly, okay, so they will not get these muscle cramps. So without this particular practice, directly you are going on the first and second day, you may face these problems. I also got the problem, okay, but once from the second day onwards, I never get this particular problem because our PT is perfect. So that's why PT is also very, very important morning, okay. So regarding the PT and all in the next lecture, I will tell you. So please observe carefully. Leg movement, observe carefully, okay. Keep your hands in the streamlined position. You don't do like swimming and all. So legs, simply do like that. So it will take you forward. Okay. This is what you need to do. Next one is regarding the leg kicks and all. The same thing I am telling. So don't bend like this. You should not bend like this. Okay. Stretch it as straight as possible. Even this position also, you just stretch it, stretch it. Okay. And then simply cause them do the movement like this, water movement like this. So you will go forward. Okay, this is what I am saying in this particular video. Okay, only these things I did, that underwater BCD removal replacement, weight removal replacement. So these things also you will be doing there. Not only this, so many other skills also. At least that list I have mentioned there, no. So please go through that particular list at least. Okay, so please try to watch some videos, more videos, so that you will get more clarity. So once you are going there, you can easily understand this. Names are important, exact procedure is important. All these things, please practice. Okay. So that's it. So with this particular one is completed. So we'll meet in the next lecture. Thank you.